You mentioned the VA scandal, the scandal that came to light about the long delays for vets waiting to get care. Have we seen things improve? There was a program created called Veterans Choice to try to bring health care closer to veterans who live far away from VA facilities like the North Country. We see the veterans driving 170 miles each way, 350 round trip to get their health care. Is that program applying up here in rural areas like this, and is it helping veterans?
Let's put some things in proper context first. When you talk about wait times and you talk about what you hear in the mass media about wait times, there's two issues that we look at in the VA. VA healthcare and VA compensation, or the benefits. The VA is an umbrella organization, national institution, that has three different administrations under the VA umbrella: Health Administration, Benefits Administration, and Cemetery Services. Many times an individual will file for service-connected disability for a condition that they believe is related to military service, and may need that to gain access to VA health care. And that whole wait time can be construed as an entire wait time for health care. In reality, it's not. Healthcare eligibility in the Department of Veterans Affairs is based on service-connected disabilities or income. And under current enrollment eligibility, this year's eligibility, if you have a veteran and a spouse and make more than $35,000 a year, you're not eligible for VA healthcare. Well, that takes a large average out of the scope.
If both spouses are working.
Yeah, and in most families today, both spouses have to work. So that can be difficult. But if you have soldiers that are coming back from Iraq and Afghanistan, and they're combat troops, and it's identified on their DD-214 properly, they're eligible for 5 free years of enrollment into VA healthcare for any of those potential conditions that may be service related. But again, getting the paperwork enrolled. Now let's throw in the Veterans Choice Program, which was the Secretary of the VA's way to answer Congress's concerns about access to care. VA Choice Program was developed and first came out in the media when the Secretary of the VA said, we're going to have this program. The VA medical center directors and administrators still don't know how to run that program. The reality behind the Veterans Choice Program is that it is run by a non-VA private healthcare institution. HealthNet currently is a company that manages the Veterans Choice Program. HealthNet was geared by the VA to go out and find doctors that would service these veterans at the amount of money that the VA pays, a federal pay, Medicare rate, and to take care of these veterans for whatever their medical needs are if they get into the choice program. Reality is, healthcare is sparse. When you look at the North Country, healthcare, especially specialty care, is difficult to access here in the North Country, whether it be private or government. Now you throw this choice program on top of it, and you have HealthNet, which doesn't normally operate in the North Country, trying to get veterans to get the services they need through the choice program. You see the pyramid that's building. It's difficult, it's arduous, and not always useful. The VA also uses fee basis, which is for non-VA care, and Choice First program, which is another convoluted program to pay for services outside of the VA. When you talk at the individuals that administer these programs at the VA Medical Center, they get confused between the three. So now you're going to throw this on a veteran that may have psychological or drug or emotional issues. Where do you expect it to go? It's a problem that has been developed by our own government that has not been well thought out and well put together. It's not administered properly. It doesn't have the proper funding that it needs. And it is like a maze for veterans to try to get through this process. You're given a number to call that when you reach somebody to talk to, they're throwing questions at you that it confuses the best of people. So it's a problem that is not well designed for those that need it most.